The next item on our agenda is House File 2607 from Representative Finke. I will move House File 2607 be re-referred to the Health, Finance, and Policy Committee. And Representative Finke has the A1 amendment, which I assume gets this bill in the shape you'd like us to consider it.
Yes, it does.
Any discussion to the A1 amendment? I will move the A1 amendment. Any discussion to the amendment? Seeing no discussion, all in favor say aye. Aye. Opposed? Motion prevails. A1 is adopted. Representative Finke, to your bill as amended.
Thank you, Chair Stevenson and committee. This being my first time before this committee, my name is Lee Finke. My pronouns are she, her, hers. And I'm excited to bring House File 2607 to you for your consideration. It's a very simple bill. It just clarifies what is already mandated in insurance coverage for gender-affirming care to make sure that everyone has a clear understanding of what it means to administer this and to cover it. That's all it does. It's a very small piece of policy, and I appreciate your support.
Thank you, Representative Finke. We do have some testifiers. First, Ash Tifa, if you could state your name for the record, proceed to your testimony. Welcome to the committee.
Thank you, Mr. Chair, and thank you, members of the committee. My name is Ash Tifa. I use she, her, and hers pronouns. And I work for Rainbow Health, and I'm their legal services program coordinator. I'm here today because what we do a lot is deal with barriers to gender-affirming care. And since 2015, we have seen a movement in Minnesota to regulate that care. And to echo Representative Finke's point, this is already what we're doing. This bill would codify MDH and commerce policy that has been on the books since 2015. That is to cover all medically necessary gender-affirming care. By doing so, it establishes a consistent framework for patients, healthcare providers, regulatory bodies, and insurance companies alike. This bill specifically outlines that this care is medically necessary care and aligns that definition with the 62Q53 definition, which is already law as well. So to Representative Finke's point, this is coverage of care that is already on the books through Department of Commerce and Department of Health policy for the better part of the last decade. And I'll leave it at that.
Thank you for your testimony.
Thank you.
Next, we have Kat Roan. If you'd come forward, state your name for the record, proceed to your testimony. Welcome. Welcome back to the committee, I think.
Thank you. Good to be back. For those who don't know me, Kat Roan, they or she pronouns, Executive Director for Outfront Minnesota, our state's largest LGBTQ advocacy organization. And I just want to start by saying this is the issue that got me into advocacy work. When I went to my first job out of college, I looked at our health insurance policies, and there was a blanket exclusion for all care related to trans health. That was common practice at the time in many plans across the country. This was not in Minnesota, for those wondering. But I walked into HR and said, "Did you know this is here?" And they said, "No." And then we changed it. And I'm here to keep changing that so that other folks don't have to fight and advocate for themselves, and so that we can all get the health care that we need and deserve. As Ash and Representative Finke said, this is really about conforming our law to make sure that it matches with the guidance that's already on the books, and to ensure that both insurance providers as well as those seeking care and physicians have clarity on exactly what should be covered and how and where. Our state public policies are already covering this. Many private insurance plans already cover this well under the current guidance, and this is a chance to provide that essential clarity and clean up the books. I'm excited to move this bill forward. I think it will have life-changing impacts for folks who have had to wrangle with insurance providers over the years, and I believe that it will make substantial changes for how trans and gender-expansive Minnesotans are able to access best practice health care. So thank you. I urge you to support this bill.
Thank you. Next, we have Rebecca Delahunt. If you could come forward, state your name for the record, proceed to your testimony.
Mr. Chair and members of the committee, my name is Rebecca Delahunt, and I work as the Director of Public Policy with Minnesota Family Council. HF 2607 requires all physical and mental health plans offered by insurers who operate in Minnesota to include what the bill authors call gender-affirming care. which the policy states must now be designated as medically necessary. HF 2607 further clarifies and expands last year's statutory inclusion of state taxpayer-funded insurance of so-called gender-affirming care. Last year, a Forbes reporter noted how longitudinal data collected and analyzed by public health authorities in Finland, Sweden, and England have concluded that the risk-benefit ratio of pharmaceutical and surgical interventions for youth in this way ranges from unknown to unfavorable. Finland, Sweden, the UK, and Norway are shifting toward a less medicalized approach that addresses possible psychiatric comorbidities and explores developmental etiology. Dutch newspaper AD quoted Thomas Steensma, one of the researchers of the famed Dutch protocol, who said, "It is still unclear whether these administered hormones affect the fertility of boys and girls. We just don't know," says Steensma. "Little research has been done on treatment with puberty blockers and hormones in young people. This is why it is also seen as experimental," end quote. The WPATH files released on March 4th show how WPATH has misled the medical community, all while leading insurance companies and legislatures with its protocols. In short, there is lack of consensus within the global medical community on how to treat minors. The USA is behind our European neighbors in this understanding. So when we consider this division, forcing all insurers to pay for this is misguided, and forcing all state taxpayers to pay for so-called gender-affirming care is coercion. Children cannot give informed consent on treatment that alters or potentially removes their sexual or reproductive health. Please vote no on HF 2607. Thank you for your time.
All right, we will now move to amendments. Representative Schultz, you have the A2 amendment.
Thank you, Mr. Chair and Representative Finke. And working at your bill and listening to your testifiers, I hear a desire to work on making this more inclusive and for us to work on the clarity. And so that's why I'm bringing forward the A2 amendment, which I think adds additional clarity. And the amendment would provide for coverage to be included to cover individuals when they seek to undo their previous personal medical procedures. And so I'm seeking your support and just add this to be more inclusive to all of the individuals seeking this care. Thank you.
Representative Finke.
Thank you, Chair Stevenson and Representative Schultz. Thank you for your amendment. I'm going to ask the committee to vote no on this amendment, and I want to make sure it's very clear why. We just heard a little bit about the data, but we just finished the largest survey of trans people ever conducted in the United States. 90,000 people. Every 4 years, the National Center for Trans Equality does a survey that this time it had 90,000 people. And in that survey, 95% of the people surveyed reported that their lives they were more satisfied with their lives after gender-affirming care and transition. Of those 90,000, 3% identified that they were less satisfied. All healthcare has regret rates, and if you talk to anyone in the health industry, they will tell you that a 3% regret rate just doesn't exist. It just is as low as you will ever find. However, there are people in the category that Representative Schultz is talking about. Some people refer to them as detransitioners, people who transition and then retransition. Those people's gender journey is well respected within the trans community, and their medically necessary health care is already covered. That is gender affirming care, and it is covered under the current law. So that this amendment is simply unnecessary. We already include them in our community and take care of their health care needs.
Further discussion to the A2 amendment.
Mr. Chair. Mr. Chair.
I was going to give you closing comments.
got it.
I'm just asking if anyone else has a discussion.
Got it. Thank you.
I'll come back to you as the author of the amendment.
Very good.
And there is no, so closing comment, Representative Schultz.
Yes, thank you, Mr. Chair. And I'd argue that especially in the lens of this bill and this conversation today, we are seeking to be inclusive. We are seeking clarity. We are seeking to protect minorities. We are seeking the safety of others. We are seeking to avoid discrimination in the laws that we put on the books in Minnesota, which is why I bring forward this amendment to this bill to further clarify in law with this simple language to provide more safety, to avoid discrimination, and I ask for your support. Thank you.
All those in favor of the A2 say aye.
Aye.
Opposed, no? No. The motion does not prevail. The A2 is not adopted. Discussion to the bill, Representative Cagle.
Thank you, Mr. Chair. Representative Finke, thank you. I think that this is a suicide prevention bill. And I think that we all need to think about that and realize that this could save young people's lives. And so I'm disappointed that anybody would be opposed to saving young people's lives. Thank you.
Representative Finke, closing comments.
Thank you, Chair Stevenson and committee members. I'm grateful for this opportunity to expand healthcare coverage to people who need it, all people who need it, and I appreciate your support.
All right, I will renew my motion that House File 2607 as amended be re-referred to the Health, Finance, and Policy Committee. All those in favor say aye. Aye. Opposed? Motion prevails, and House File 2607 as amended is recommended to be re-referred to the Health, Finance, and Policy Committee. Thank you, Representative Finke.